The long-awaited legislation to bring e-cigarettes and new generation tobacco products into the regulatory net for the first time. That's expected to be presented to Cabinet by the end of the year. The vaping industry has stepped up its lobbying, hoping to persuade government to view its products favorably. Now, vaping products or e-cigarettes are currently unregulated as they do not contain tobacco. Now, joining me to expand on the legislation concerning e-cigarettes is Peter Ucko, and CEO of the Tobacco, Alcohol and Gambling Industry Advocacy Group, as well as Dr. Sharon Nyatsanza from the National Council Against Smoking Communications Manager. Thank you so much for joining us. A very good morning to you both. Peter, I'd like to start off with you. The e-smoking bill is expected before Cabinet. It's been a long time coming. What are your thoughts around this?
Well, let's start with this term of vaping and vapes and vapor. That's an industry term and it's nonsense. When we say vapor, we generally think about water vapor. What these devices emit is an aerosol, now called an aerosol, and they are emissions which contain toxins. There are many, many chemicals and poisons and cancer-causing agents in those emissions. So let's get away from that kind of nice term. They say, oh, would you like to vape? Let's go and vape. It sounds nice, but it's a deadly killer product. You're sucking on an electronic device which emits aerosols and is not healthy. That's the first thing. The second thing is because they are not safe. And let's not go into the industry arguments that they say it's 95% safer than other products, etc., etc. A lot of that research was paid for by the industry and is not accurate. But it doesn't matter if it's 10% safer or 20% safer, they are not safe. They cause harm, they addict children, and that's a huge, huge problem. Children who might never have started smoking start playing with electronic devices, suck on them, are tempted and drawn in by the exotic flavors that they have, and there's about 11,000 flavors, would you believe? And then, because they get used to this habit, they convert to smoking conventional combustible tobacco cigarettes. That's the grave danger.
Now, let me turn to you, Dr. Nyatsanza, the bill that's expected before Cabinet in terms of wanting to have it out there and the reasons why it should be put out in full force. Let's talk a little bit about your thoughts on that.
So definitely, as Peter rightly said, we cannot experiment with young children. So e-cigarettes or electronic devices have to be regulated because they are harmful products. And as any harmful product, we need to stop the youth from using them. So what we currently have are products that are being sold in all our shopping malls, open for children to see. We see, these trucks that are selling these products all over the country, selling these products to young children. And the flavors that these products have, we have things like bubblegum, cherry, which are obviously directed at actually manipulating children to start using these products. And these products have nicotine. But the danger that we have is we don't really know what is in these products. So there are over 11,000 flavors, like Peter said. But some of the products say they don't have nicotine, while they actually do have nicotine. So we definitely need to speed up the bill to ensure that, we stop children from starting to use this product and getting addicted to nicotine. Nicotine itself is harmful, besides being addictive. And it actually harms the adolescent brain. Science does show that when children start smoking before the age of 21, and actually even young adults before the age of 25, this actually does harm their brains as well. So we definitely do need to speed up the bill and protect our children.
Peter, let me ask you this. How will this bill assist in ensuring that these dangers are out in the forefront and that there is some sort of regulation to the e-cigarettes and the vaping industry?
Well, the bill proposes similar methods to controlling tobacco products. They're similar but not the same because electronic devices are generally not combustible products. So things like controlling the emissions and the additives that go into them, the packaging, the banning of advertising, all those measures which we know have worked with tobacco products will be effective when it comes to electronic devices. Banning their use in public places in the identical fashion that we will do with tobacco products, because at the moment we allow indoor smoking. There are certain limitations, 25% of the floor area and an enclosed space. Electronic cigarettes will be banned wherever tobacco products are banned. And graphic health warnings, all the things that we know work for reducing the prevalence and the consumption of combustible tobacco products must be applied to these electronic devices. It's the greater good for public health, and it's a huge step in protecting the health and the future of our children.
Let me turn to Dr. Nyatsanza. You speak about the addictions of nicotine, but in terms of the understanding of nicotine and tobacco, what are the stark differences there?
So, the thing is, with electronic cigarettes, they don't have tobacco itself. And, our cigarettes are made of tobacco. And even our new, heat-not-burn tobacco products are still tobacco. Things like the hookah pipes are still tobacco. Yes. But the electronic cigarettes do not have tobacco. So they still have nicotine, which is one of the, the most similarity amongst them is that they still have nicotine. But the thing is, even e-cigarettes also have other compounds that are actually cancer-causing, that are common to both e-cigarettes and tobacco products. But the problem that we still face is that, these are newer products, and it will take longer for scientists to fully understand the long-term impact of using e-cigarettes. But the problem that we're facing as well, and something that should be, of alert to the public health community and to everyone, who is a responsible citizen, as a community, is that we're already starting to see that e-cigarettes are already starting to be linked to high risk of stroke. They're starting to be linked to cancer, to heart disease. So the difference is the chemical compounds are different, but they're still also harmful. And the other challenge definitely that we will face is that, with the new complexity, some of the harms will only manifest after a longer period.
As I move this discussion to you, Peter, you have been speaking quite strongly against the use of tobacco products, and you said that the minister didn't really have to wait up until the bill had been brought into effect to tighten some aspects of tobacco control. What do you mean by that?
Oh, there's several steps that the minister can take immediately to improve public health and tighten tobacco control. For example, he can ban displays immediately. There was already a regulation published for public comment, and it was never taken any further. If the minister polishes that published regulation and then publishes it for immediate effect, we can ban displays immediately. We know that the industry uses retail displays as advertising and tempting mechanisms to get people to smoke and to keep them smoking. Imagine a smoker goes into a store and all he wants to buy is, say, a loaf of bread and a half a liter of milk. And behind the shop assistant is a wall of tobacco products, all sorts of brands of cigarettes. That triggers in his mind the reminder that he used to be a smoker. Maybe he's quit last week or last month. That triggers in his mind the memory of the temptation and the addiction to nicotine. And he might say, oh, I'll have the loaf of bread, half a liter of milk, oh, and give me a packet of Brand X. They know that that works. The minister can ban those displays immediately simply by publishing or republishing that set of regulations for implementation. Banning smoking in public places. Immediately. It's a simple step. All he has to do is withdraw the regulations that permit smoking in public places indoors. That says 25% of the floor area, fully enclosed, separately ventilated. Withdraw those regulations, and instantly there will be no more indoor smoking. That's an easy step. Plain packaging and graphic health warnings, we have a legal opinion that the current act was designed, by the way, it went through Parliament to allow for graphic health warnings. So we have a legal opinion that says it can be done. And the minister can introduce regulations, which have already been written, by the way. The minister has them. He just has to publish regulations about plain packaging and big graphic health warnings, and bingo, we're another step forward. Ingredients. It's allowed for in the Act. The minister can just say to the industry, give us a list of your ingredients. We want to know what you put in, what quantities, everything. It can be done right now. We'll have better public health and fewer deaths.
And as we round up this discussion, Dr. Nyatsanza, you spoke about the dangers of the vaping and the e-cigarettes to one's health. What do we know, especially in the face of COVID-19 and, of course, given the huge contestation around whether or not tobacco products should be sold during COVID-19 and the court battles that we saw a few months ago? What are some of the dangers when it comes to second-hand smoking, especially as we face this unprecedented time of a pandemic?
Definitely. So the science that is available does show that people who use tobacco products might actually suffer with COVID-19 symptoms. So they are at the back foot. This is because products like tobacco products harm the lung system, and this is very important in fighting an infection like COVID-19. So they also weaken your immune system. So even though you do not use the tobacco product directly, if you actually inhale second-hand smoke, you are inhaling the same dangerous toxicants that the person who actually is smoking is also inhaling. So you see that even people who actually are inhaling second-hand smoke also have a weaker immune system, and they are also doing damage to their lungs. So right now, obviously, the evidence is not conclusive because the pandemic is actually also new and we're still learning. But definitely, using tobacco products does weaken your immune system. It does weaken your lungs. And in terms of e-cigarettes also damage your lung system as well. We've seen in 2019 in the US, a lot of people died from, e-cigarette lung disease, lung-related diseases as well. And we saw a lot of people being hospitalized, and many of these were actually young people. So our advice definitely is to stop using tobacco products, stop using anything, even if it smells nice like the hookah pipes, even if it looks fancy like the e-cigarettes, it still is dangerous, it still harms your lungs, and it's still, if you stop using these products, you are in a better position to fight infections like COVID-19.
Very well. Thank you so much for your time there on the line. Dr. Sharon Nyatsanza, Project and Communications Manager at the National Council Against Smoking, as well as Peter Ucko, CEO of Tobacco, Alcohol and Gambling Industry Advocacy Group, speaking as the e-smoking bill is expected before Cabinet before the end of this year.